everybody. This is Dr. Connie. Welcome to my show, Functional Yoga Medicine. I hope you guys are all doing great. I can't believe it's already middle of September 2021. And I can't tell you, as I look around at our lives today, how different everything is. And I had always hoped to go back to the life before COVID, but now it seems we're creating day to day what life would look like going forward. There's some things that I recognize within myself and my practices where my business has shifted forever. Some in a good way. I do find myself trying to hold on to the past, but that's when I have to realize, that no longer is. Our new future looks very different, and it's time to really welcome and embrace the new future and really love what is. And that's the choice that we get to make every day. So I just had a doctor's visit today, and there was a lot of things that I want to share with you in full transparency and really share what I really think about and why I created functional yoga medicine. So the topic of today's episode is difference between medical treatments and healing. So I have not shared much about my health issues, but ever since probably March of this year, my physical body, my health has been kind of up and down. It's been a roller coaster ride. And I'm not going to mention anything, but the big C, I really do feel like my autoimmunity may have been triggered because after being in remission for so long, it was triggered due to, the big V that I want to tell you about. And it really, after the second dose, it really floored me. And then it's been downhill. And my body just kind of had a flare up, and it's kind of getting better now, but it's been a long haul. Not used to being so tired and out of control and struggling. But this has been a year where I really learned about my mindset, about my underlying beliefs that I hold. And it really tested me as a practitioner as well as a patient to really practice what I preach, right? Because health crisis really does allow you to take a second look. And I know many healthcare practitioners, my colleagues and my friends and alike, they're very private about their own issues and, health crisis. And it's one that we don't want to talk about because I find that as medical practitioners, if you are one, especially medical doctors, you guys have a lot of insecurities that you mask through the knowledge. And so we rely so heavily on evidence-based medicine and everything about research and science. When we do that, we limit our ability to be expansive. We really confine ourselves to symptoms treatment versus living from possibility. And anything outside of that, like empirically, there's a lot of studies like near-death experience that NDE people in the field of cancer. And every single day, there's a lot more empirical evidence to prove the importance of neuroscience and really quantum physics to dictate the healing capabilities within that cannot be explained with science alone. But when we start to limit ourselves to the science alone, a lot of us, Western trained medical practitioners are very weary of that. It's almost like it was frowned upon. I have a lot of colleagues who won't even go there. But more and more, it's being embraced by the likes of thanks to the likes of Joseph Dispenza, as well as Deepak Chopra, and all the other science based, also very mystically based medical practitioners. But it's still one of those alternative therapies that is boo-hooed. And I think the science, the knowledge, the intellect, and the finite to know more really stumps all the miraculous things sometimes that we can't explain, right? And so they call that the woo-woo, right? But now I believe into the woo-woo science, not too much. I need some level of grounding, and I believe we need both, the full spectrum, right? And so that's really why I created the alkaline methodology within the context of the functional yoga medicine. So you guys can really incorporate and have a framework to really understand the methodology in a way that you can address everything, all element pieces, the 4 pieces of the alkaline methodology, to really create a truly integrative effect in or through patient care that you can utilize with the tools to make sure you enhance your practice in this way. Because I believe medical education really perpetuates insecurity. We're really judged upon how smart we are, our grades on the test. It's all about performance, and it really does promote the doing. And so you and I both know, if you're heavily based in science and Western medicine, we're required to know a lot more, right? We're required to keep up with all the data, all the science and new research papers that comes out every day. And if we're humans and we're being really honest with ourselves, there's no way we can know it all, right? And there's contradictory research, and to refute all of the things that's coming out by the minute, like worldwide in the research journals, it's just really impossible. So if you're going to be stuck to that and navigating that, which I try to do for 2 decades too, but the deeper I get in the research study and the evidence-based medicine, there's so much murkiness down there. And as a personal experience as a patient with autoimmunity, that really affected my immunological standpoint, as well as my gut digestive issues, as well as my neurological issues, and it hits everything. And my systemic effects of all my organs, my detox organs and metabolism and all the things. It's sort of like your body has too many things to consider, too many variables, that when we look at one element or one pathway biochemically, then we miss the bigger picture. So we always want to make sure that we have a global perspective, the bigger picture point of view, and really work on what's driving, not with your knowledge of healing your patients, because medical science doesn't heal. It perpetuates anxiety and fear. Just had a meeting with my nephrologist and my rheumatologist and my hematologist, right? There's also some values that we're looking at, and constant thing that they talk about is the research, right? And when I talk about the hope of doing all the things with all the tools that I have, they want to hear none of it. They just want to share the worst case possible scenario, right? And when you do that, when you disclose these types of negativity within the context of research and science and telling and being transparent with your patient, you almost are robbing them of the miraculous ability. Their belief now starts to wane towards the worst possible scenario. And when the patient's beliefs shift from the worst case or the best case scenario of having hope to worst case scenario, and they start to believe it, well, we know that thoughts create feelings, feelings create or trigger actions, and actions create the results in your life. And so this perpetual negativity, you as a practitioner, sometimes inadvertently, without you even knowing, you're creating that for your patients. So it's one that I do want you to think about and consider, because really that's the difference between medical treatments and healing, right? Medical treatments really does deal with the symptomology, a small picture, but it might create a secondary side effect. But what do we tell our patients? Well, we tell our patients benefits outweigh the risks, right? Always. We want to decrease the symptoms. And through those symptoms, when we decrease one symptom, what do? Create another symptom. Then we have to give medication for that symptom. And when that subsides, another symptom arises and we have a medication for that. And so that's the mad science of it all. And so you have to really consider at the end of the day, the big pharmaceuticals and then the medical complex, they're all for profit, and its main role really is to keep patients sick because they profit from that, right? The insurance companies and all that. And so while you might have a cushy job and you might have a nice pay, if you're listening to me, there's some level of discontentment within. You know that there's something more. You want to be your own boss. You just don't know how to do it, or you are your own boss, but you hide behind clinical relevance or more education to try to do more. And you hide behind clinical skills. But you know what we need is street smarts, common sense, simple, logical, practical, and functional approaches to solutions where we can share the tools with our patients, make it super easy for them so that they start healing on the inside. We're not doing the healing for them, you guys. We're just pointing them in the right direction and making sure that they're able to switch their beliefs and really instill the power from within them so they can then command their own bodies to heal. But a lot of practitioners, what do we do? And I was there too. I want to be good. I want to be a good clinician. And I believe the more clinical education, more letters behind my name I had, the more ego I can boost up, more desirable I can be as an employee or even a business owner. A business owner running a business is really different from didactics of medical education. So in the health and wellness industry, no matter what background you come from, the running of the business side is really an art. It's the street smarts, it's the common sense approach. Really, at the end of the day, stripped of everything, it's all comes down to mathematics, really. Making how many offers to get what, how much money do you want to make, what do you have to do, how many units do you have to sell, so what's your marketing plan? It's really simple. It's all about the numbers. And you just rinse and repeat, minus all the drama of not good enough, right? We always feel like we don't feel good enough. And the more education we have, we want more control over our lives. We want control over our reputation. We care more about other people. We think our profession, there's more on the line. We have more to lose. But at the core, we're very insecure human beings who constantly feel not good enough. And we're living in constant fear of being found out. We all have imposter syndrome. And when we hear the woo-woo-y side of things, we want to believe into it, but we do so in closet, right? We do it in hiding. At least I did for over a decade. And as you're sitting there listening to my podcast, you probably are like, if you really are truthful with yourself, that's probably what was drawing you anyway. Because talking about the variables of sickness, right? When we're talking about the difference between medical treatments and healing, it's really two polar opposites, right? And this is what I talk about in the alkaline methodology within the context of functional yoga medicine, right? There's 4 elements. One is transformational psychology, where I take my patients from inner awakening to outer manifestation, how those two are completely linked. You have to master that along with the coaching abilities, not just your clinical didactic knowledge. You need to have bedside manner. You need to really help transform. In order for you to do that, it's not like your first goal shouldn't be to be liked by your patients. It's making impact so that they see what they need to do. Like making an impact is never being their friend, but really you have to coach them through so that you can get ahead with what's going on in their head. And how you can do that is by you experiencing the transformation and the growth in your own life, to be able to experience the inner awakening and really getting real with yourself and aligning with exactly what you want to do in life, as opposed to just being a technician doing what you do because that's what you went to school for. You have a cush pay and you have to pay off the student loans and you have children, you have overhead to pay, whatever the deal is, right? But the courage that it takes for you to really make a difference today more than ever, post-COVID. The digital space, the technological advancements allows you to do so much more. But what does it involve? Well, it involves courage from you and the belief and the identity that you can do this, because fear is keeping you exactly trapped in the system. And you're there on a hamster wheel, just busy being a technician doing the same thing over and over again. So whether it be a medical doctor, physical therapist, or pharmacist, or whatever, everybody who's that profession At the end of the day, stripped of everything, they all do the same thing, right? We're taught the same clinical skills, and that's what we do. There is a certain written, almost an unspoken law of how to practice what we do, and we have to play within our scope of practice. We don't veer into other lanes, and these are the things that we do really well. We've been indoctrinated to think regulations and following directions is what we do best, and then guess what? We excel. Better get those A's to graduate from medical school, to get matched for residency, or whatever else you want to do there, going forward. So what I want you to consider is that medical treatments are just Band-Aid approaches, and we kind of all know that from the standpoint of, but we do know sometimes those Band-Aid approaches are necessary. I'm not saying anything wrong with that, but the long-term effects of healing, right, involves the inner emotional trauma and really looking at those things to heal, really switching their identity at the core level, and really allowing them to be aligned, your patients to be aligned with who they are from within. Because a lot of the times, more often than not, if a patient has some type of a disease process, I will tell you that there is a lot of struggles that they go through, right? There's finances, there's relationship woes, there's past traumas, there's abuse, there's challenges in their lives, right? Emotionally, mentally, and physically, that sometimes medical doctors, we don't really have time to even ask them beyond just getting to know them at the first visit. And so these are all things you have to consider. You have to learn how to be a human being. And sometimes we complicate rather than simplify. Simplicity really stumps complexities, right? And I used to have a habit of feeling like I needed to use my professional jargon. And a lot of you do the same the higher up you go. But we have to meet them at a level. Outside of your profession, if you were to go to Home Depot in your sweatshorts and flip-flops and a t-shirt trying to fix something, a toilet, right? Something. That person is who we're treating, as opposed to whatever title, CEO of a bank or whatever title that we want to kind of hold, right? And so we really have to meet them at a human level, and that humility needs to be one that we need to practice and really meet them at a practical level, right? And really, we distill things down into 4 elements, like I said. The first element of the alkaline methodology within the functional yoga medicine matrix is the transformational psychology, where we walk them through the inner awakening to the outer manifestation. And then the second element is the modern medicine, where I break it down to HPA, TG, right? Hypopituitary, adrenal, thyroid, and gonadal. All the endocrinological systems that involve stress management, breath, and all the tools that you can deploy. So instead of looking at the hormones, why adrenals are fatigued, and why measuring that and giving them the supplements, how about if you teach them how to breathe? How about if you allow them to connect their mind to the body? How about if you help them to manage their stress? Better yet, find out what their stressors are to coach them out of that through their inner awakening and outer manifestations, to eliminate that altogether before you even have to address the biochemistry, right? But oftentimes, what are we taught to do? Look at the complex science. Look at all the hormones, all the cholesterol, all the pathways that really intimidate us in our education, right? It's unnecessary. It's necessary to the extent that we know that, but it's unnecessary to the extent that it's not something that's going to help our patients in a real way, right? And then the second thing is the enteric nervous system, the gut feeling, right? We have leaky gut syndromes leading from the HPATG axis, which is the stress brain component, and then leading to the enteric nervous system, which is our gut-brain connection, which then ultimately causes what? Inflammation to trigger the immune response. So we look at the psychoneuroimmunological aspects of it through the modern medicine element of the alkaline methodology. And finally, we come to the ancient wisdom, where we incorporate yoga. And yoga is not about flexibility. It's not about going into poses. Yoga stands for your opportunity for growth and abundance. We look at the energy, the chakra, the meridians, the energetic flow in the body, and how the feelings, the thoughts and beliefs and the actions that we take create these energy blocks, right? And then we talk about silencing of our minds through hypnosis, reprogramming our subconscious mind, as well as meditation, silencing our mind. And then, of course, the last element is business mastery, because many of the practitioners are completely devoid of business training. We don't know any science, we don't know investments, we don't know how to run a business, and we don't know people skills. And these are all moving parts to create systems and processes to have a business that works for you. And at the end of the day, we're all here to make money. And so many practitioners shy away from talking about the profitability of their business. But guess what? If we're not profitable, we can't continue to do what we do and help patients. So we don't have to hide behind and be sacrificial behind all that. And this is what I experience at a lot of my seminars and trainings. Nobody wants to talk about money. It's only an afterthought, but really it's at the forefront of their minds, but they're not being honest about it. So business acumen is really, really necessary to run a practitioner business, because by virtue of you being in holistic alternative space, you are an entrepreneur. You have to start thinking like a health CEO entrepreneur, as opposed to just an employee technician that you're conditioned to be, right? And so these are the things that we teach. So I'm hosting a workshop called the Business Mastery for Health Practitioners. It's on September 28th at 5 p.m. Eastern Standard Time, as well as the 29th at noon Eastern Standard Time. And once you opt in to figure out what type of practitioner you are, then you get opted in, and you can opt in to register for that webinar. And then there's so much bonuses that I share with you in the light of really creating financial freedom. Because at the end of the day, why does that matter? Well, I don't know about you, but I've got 2 little ones, and I want to make sure that I provide for my children in a way that they need. I don't want them to come out of school with debt because of their college tuition. I want them to be ahead of the game, and I want influence, and I want affluence, and I want to reach more people. And in order for me to do that and support my employees, I need to make my business a success, and I'm not going to lie. And that's a value that I had to learn to have, because my relationship with money was very poor in the beginning, and I had a lot of struggles with it. And I had to rethink and re-engineer a way for me to really think business in a different way. So that's what this is all about, really coming straight up and really simplifying and really being practical, and then providing functional approaches to patient care where you can practice what you preach, as well as be really authentic in what you deliver. So everything is simple and approachable, and you're able to meet the full spectrum, west to the east, knowledge to the mysticism, to the modern medicine, to the ancient wisdom, right? Inner to the outer. All the things are included in the context of the functional yoga medicine. And so that's what this show is all about. And if you enjoyed it, I would really appreciate it if you would subscribe to our podcast, as well as to leave us a review. It really helps to spread the word. And I just want to personally thank you so much for watching. And I hope to see you on that webinar where you learn so much about yourself and about how to proceed forward to be the best version of yourself. Thanks so much for watching, and I'll see you guys all soon.